So how many patients in your practice do you have that could benefit from orthodontic treatment that aren't willing to do so? Well, let's talk about clear aligners because I can guarantee you patients will accept that. My name is Ferris and I'm an orthodontist in Santa Barbara, California. The data shows that 74% of all patients could benefit from orthodontic treatment. But the reality is only 10 to 20% of that's actually diagnosed, and only another 1% of that's actually actively being treated. So what that does is it really opens up the amount of people that should or could be treated or benefit from orthodontic treatment. When we look at what we're doing, I mean, I always explain it to a patient like it's kind of like building a house, and you're not going to build a house or put a bunch of money into a house on a poor foundation. But we do that in dentistry all the time, where because the patient might not want to do orthodontics or the dentist might not diagnose it. But of that 75% of those patients, or 74% that I mentioned, 50% are pretty mild cases that general dentists can actually treat within their office. And what it can do is it's more of a preventative approach where if you start looking at your exams differently and look at the perio first, look at the ortho, and then look at the restorative, then you can really treat preventively and really benefit the patient. Looking at hygiene and periodontics, if you can get the teeth aligned, it's just going to really benefit what they do. Then the other 25% of that's a little bit more challenging. Maybe not something that you'd want to treat as a general dentist just because it's not going to be profitable, it's not going to be efficient. But then that's when you rely on your specialist, your orthodontist. And a lot of these cases that I treat now are more interdisciplinary, where we're working as a team. But what I can do with clear aligners is actually, one, the patient's going to accept it, and a lot of times they'll even come in asking for Invisalign. So it makes it a really easy proposition for them. But at the other side of it, the things I can do are actually more efficient and even better than what I can do with traditional orthodontics. And so think about opening space for implants or intruding teeth for space for restorative, or just allowing to bond to enamel instead of dentin because we get everything in the right spot. So basically what it's doing is just adding to the value of what you're doing or what the restorative dentists are doing, and ultimately just affecting the patient in a really positive way.